We'll get our
Recording in progress.
Hello, everyone. Good evening. My name is Darcy Drager. I am the chair of the Morris County Democratic Committee, and today we are welcoming Dr. Tina Shah to our CD7 screening committee. She is running for Congress here in the 7th District. I am joined today by our screening members, Brian Considine, Andy Meisner, Bill Kersey, Gary Colucci, and Mike Delamater. So I'm going to just jump right in the interest of time, and I'm going to ask you to tell us a little bit about yourself, what inspired you to run for Congress, and what is the core message or vision you hope to communicate to voters?
Well, thank you so much, Chairwoman Drager, and it's nice to see everyone. I know Brian and Gary, and Bill, we haven't had a chance to deeply talk yet, but I look forward to this conversation here with you and Mr. Vice Chair and Andy. It's so wonderful to see you both. So as Darcy mentioned, my name is Tina Shah, and I am a practicing ICU doctor, and I'm running for Congress because America literally is in critical condition. And I wanted to share that a few months ago, I treated a woman who had managed her asthma for years. And Mrs. J then had to change her insurance company. And that's where her story started, where the insurance company denied her inhalers. She ran out. She couldn't afford to pay for them herself. And she got so sick that she showed up in my ICU and we had to put her on a ventilator. This is insane that we live in the US where a company is placing profits over human life. But that's where we are. I've now served in the last 3 White House administrations. My first role was as the first ever National Director of Clinician Wellbeing at the VA, where I actually improved efficiencies around how doctors use technology, and we were able to make it easier for veterans to see their primary care doctor. I then came into the government a second time during the pandemic as senior advisor to the Surgeon General, where I helped to address the devastation and burnout across the entire medical workforce and wrote the nation's strategy on how to shore up the medical workforce when we needed them the most. And in New Jersey, I took on the insurance companies and started a grassroots fight where we won. We passed a bill into law last year that prevents insurance companies from denying medically essential care. In the private sector, as a business leader, I helped grow a small startup into a $5.3 billion company. So I come with this experience, but at the end of the day, what we're dealing with is Tom Kane Jr., a man who just doesn't care about us. This is a man who is literally hurting us. From not addressing our sinkholes to shifting and, not doing anything when ICE comes in and terrorizes our communities, to doing nothing to lower costs. This is what we're dealing with. Since launching my campaign, we have been able to raise over $1 million in just 6 months. And I haven't stopped there. I now have the support of Representatives Ami Bera, Dave Min, Sharice Davids, and Judy Chu. And I have dedicated my career to serving patients and fixing broken systems. And I've done that in the ICU, and I've done that in DC, and I've done it in New Jersey. And now I'm sitting before you here over this Zoom to have the honor and the privilege to do that for CD7. I will fight tirelessly, not only to lower costs, to fix our broken healthcare system, to address the threats to our democracy, and also to make sure that we protect our shrinking middle class. CD7 just deserves more than Tom Kane Jr. I am ready to do the work with you all, and I can't wait to flip this seat. So thank you so much for the opportunity to give some opening remarks, and excited for our conversation.
Great, thank you. Andy.
Hi there, Dr. Tina. Congress requires negotiation and coalition building. Can you give an example from your career where you successfully worked across differences to achieve a goal?
Absolutely. I'm going to give you 2. First, I'm the only candidate that's actually served across the aisle on both sides. I served in the Obama administration, and we all thought, Hillary Clinton was going to win, but I had a 1-year commitment where I served into the Trump administration. So as I was trying to help veterans access medical care in a timely way, it required me to work on both sides. This is a bipartisan issue, and we were able to make it easier for vets to access care.
Excellent. Brian.
Hello, Dr. Tina Shaw. How are you today?
Hello. I'm good. You can call me Tina. Feel free.
Tina? Okay. So, this question is, what do you identify as the most urgent legislative need for NJ7 as a whole, and how would you address it during your first year in office?
You know, it's almost like without a doubt, we have to flip the seat. And it has a biggest implication for NJ7 because we are not being served in any domain. I'm thinking, I mean, Andy, we were just chatting just a few days ago, and you shared the information about the vast network of community members that are stepping up to combat ICE and to help protect some of the most vulnerable people, you know, in the community. And we should be doing that, but we should also have a member of Congress that's fighting for us in a place where it counts to stop what happened with Roxbury, with a warehouse being slyly bought and now turned into a place to just, you know, stack up human beings and treat them as goods and not really human beings. So I think our biggest crisis is that we don't have good representation, followed by the biggest thing we need to do is contribute to flipping the House. And after that, you know, Brian, I think I have a whole list of things. And if I had to just name three, number one, we need to lower costs. And I think healthcare is a big piece of that. Number two, we have to protect fundamental rights. And I'm talking about the rights of everyone as we especially talk about immigration, but also our voting rights, our reproductive rights. And number three, we have to address corruption.
Excellent. Thank you. Bill.
Yes, good evening, Doctor.
Good evening.
What do you see as the most pressing challenges facing the Morris County towns in the district, and how would you use your role in Congress to address them?
Well, I think Morris County is definitely not a monolith. There are some common themes, but I think there are also some really unique things. I think I will kind of give you my landscape and would love, if time permitting, to hear from you all. But what I've heard walking and meeting people across Morris County is this. One, I have to bring this up again, but it's so hard to not talk about the fact that our most vulnerable community members are going to be terrorized by ICE. And while we have an incredible governor that is standing up a way that we can report better and community members are standing up, it's not enough that Tom Kane Jr. thinks it's fine to just talk about mitigating some of the financial costs to towns. We need to make sure we step up. And I think that's what I've heard the most. It's unbelievable. We need to overhaul ICE because we are watching this vigilante organization that used to be about immigration and law enforcement now just hurt and kill people. So I think that's a really, really big issue in Morris, as I've heard from people that live in the county. I also think the second thing I've heard is that we're dealing with people trying to stay and live in Morris. And I'm going to talk about housing here. On one side, we have, and I think, Andy, I'm looking at you, although you can't tell, but I think, you know, from what I understand in Mount Olive, there is a amazing, you know, crop of these young families, like these young professionals. And are they going to be able to stay in the county? Because housing is too expensive. And then we kind of go a step further and we think about seniors, and they're grappling with fixed incomes. They're worried about whether, you know, Medicare is still going to remain, but they're also worried about, can they stay in their homes? And that, you know, really worries me a lot. And that is one of the things I've heard. And then I think, you know, another piece which I would just share is we have just lost a lot of basic public support. And by that, I mean, SNAP has been cut, Medicaid has been cut. Some of our, you know, our basic things that our most vulnerable rely on has now been cut by the federal government, and Tom Kane Jr. said nothing. And that's going to affect some of the, you know, the neighbors we have in Morris County as well.
Excellent. Thank you. Over to you, Mike.
Okay. NJ7 presents a challenging electoral landscape, competitive mix of suburban and conservative leaning communities with Congressman Kane holding the advantages of incumbency in a significant fundraising operation. Describe your overall strategy for building a campaign capable of winning the district. How will you develop organizational strength, build a competitive fundraising base, and leverage local support from the Morris County Democrats to demonstrate electability across all parts of the district?
First, I have to say this. I want to be clear. I would be honored and it would be a privilege to have Morris County Dems support. That is what I'm seeking to get, and I hope I can get it. And my promise is this. It is just as important to make sure that we elect Dems in the local races as it is to elect a Dem to kick Tom Kean Jr. out of his seat. And I want to work just as hard, to have the double win where we have a blue wave at every single level of government. That is what I intend to do as your partner here. I want to start first with talking about the fundraising aspect, and then I want to go into the field and the ground. And on the fundraising, I raised over $600,000 in my first quarter. That is more than any other candidate in this primary has been able to do without self-funding. We are over $1 million now, now that it's been more than 6 months. And most of this has come from my Rolodex. I'm still raising from my Rolodex, actually. And so should I earn Morris County support, I could mobilize a completely new pool of Democratic donors to support candidates up and down the ballot in our district, including in Morris County. And it's not just for this election. I'm thinking about the future, and I'm thinking about for future elections too. Another thing, as we talk about the fundraising aspect, is that, I'm going to keep raising money to communicate to voters. We know that this is important. And the top issue is lowering costs. And we're talking also especially healthcare costs. There's no one better equipped to talk about this than a doctor who, and I still practice a couple shifts a month, and I was practicing on Sunday. And we had these frank conversations where I took care of a gentleman who, unfortunately, we found out has a spot on his lung that looks like cancer, but he can't afford to get the PET scan that's the cancer screening test to see whether it is what it is. This is one of the top issues for many people, where we're spending so much money on healthcare. You're then worried about, how can I also afford groceries and also afford, my housing costs? And that is my personal experience, because I treat people from all walks of life, and I will bring that to the table. I will also share that we know that Tom Kean Jr. is going to be supported very heavily because of how weak he is from a financial standpoint. And there's going to be more money than ever, probably this cycle, coming in to try and help this very weak candidate. The Democrat who wins this primary is going to need outside support. And what I will say right now is that I can attract the biggest spenders in politics. I was just having a conversation earlier with someone who is also like a politically active from Union County. And what I shared is that if we look at what's happened in the last year, there are some organizations that have spent more money than the Dems campaign committee, than the DCCC, and they're big tech. And I come from big tech, where I helped to grow a small startup, to a multi-billion-dollar business. And I'm the only candidate that can easily access this group who is interested in pro-innovation policy, which I am, not at the expense, though, of our climate, our land. This is about putting the right regulation in, but I will be able to bring in and to tap into the funding required to beat Kean. And on the ground game, in addition to, to being a physician and starting with this positioning, I'm literally the product of the American dream. My parents came from India, and they wanted to raise me and my brother here in Jersey. So many people identify with that story, and that's how we connect. And I really look forward to hearing people's stories, and not only helping them try and get the American dream, but keep the American dream, which is something that's at threat right now, whether it is stripping away our voting rights or making it so hard that we can't afford basic, groceries and gas, which is now an issue, and our mortgages, So I think there is a lot that I bring to the table. we are rapidly expanding our grassroots effort. I know, Mr. Vice Chair, we had a chance to sit down last week and we chatted a little bit about the other more New Jersey insiders that we've pulled now into the team to make sure that I can really keep a pulse on who we need to reach out to, how we reach out, how we can best serve counties like Morris County. And we're rapidly building our grassroots army. And obviously, I would love to to be the recipient of the wisdom from Morris County Dems, but we're continuing on to build out our volunteer force too.
Great.
Thank you. Okay, Gary has our candidate specific question for you, Tina.
Good evening. Tina, healthcare delivery often involves multiple layers of government. How would you leverage your role in Congress to effectively, with state, county, and local authorities, expand affordable health coverage and ensure equitable care in NJ7, particularly in our more rural and underserved communities?
And the most vulnerable are the hardest people. I mean, when we watch, let me preface that Trump is intent on letting go of the most vulnerable people. It almost feels like he doesn't think that they're worth it enough to care about their lives. But none of us on this call feel that way. We need to protect our most vulnerable. And what he's done with the big ugly bill, with Tom Kean Jr. casting the deciding vote. And let me switch gears. Tom Kean Jr. is the one responsible for the fact that SNAP got cut and that Medicaid got cut, when 1 in 5 people rely on Medicaid in our state. And when 60% of SNAP recipients are seniors or children. I mean, this is a huge problem. My first move is to get rid of the tax breaks to billionaires so that we can fund back these critical programs. And I think that's going to be huge. We're also 50th out of 50. We have returned the lowest amount of funding for rural healthcare. Tom Kean Jr. did not even fight for us. I will fight tooth and nail to make sure that we can bring money back. And that is money that's earmarked by the Trump administration for rural areas, which we haven't tapped into. And the last thing I'll say is, as a person who got to be a civilian activist in New Jersey on healthcare, I plan on expanding my deep ties to incredible legislators that we have at the State House. And I had the privilege of working with Vin Gopal and Herb Conaway when Herb was part of the state ledge, also working with Governor Sherrill in her office, and taking my continued existing relationships as the former head of policy for my tech company with the Trump administration when it comes to healthcare, because we have to coordinate these efforts. We're watching, very tactical, strategic ways that the Trump administration is trying to hurt the most vulnerable. We have to start by stopping the bleed, and then we need to look forward to other places and areas where we can bring funding back to the state.
Excellent, thank you. All right, we are now moving on to a policy lightning round, which is just 10 questions, simple yes or no. And this is just basically sort of a gut check on alignment with some basic Democratic Party planks. So Andy is going to read those for us.
Hey, you all set? Okay.
Let's go.
Okay. Do you support access to affordable health care for all, including protections for pre-existing conditions?
Yes.
Okay. Do you support policies that promote racial, gender, and LGBTQ plus equity?
100% yes.
Do you support policies to address climate change and expand clean energy?
Yes, and I want to not just address climate change, I want to slow down global warming.
Do you support reproductive rights, including a woman's right to choose?
Wholeheartedly yes.
Okay. Do you support protecting and expanding voting rights?
Yes.
Do you support comprehensive immigration reform, including a pathway to citizenship for undocumented immigrants?
I support comprehensive immigration reform, and I would like to understand the options we think are available for undocumented immigrants in this administration, because I'm worried it's going to be used as a weapon.
Do you support federal investment in public education and affordable higher education?
Yes. I think we need to stop this cap on grad plus loans that was slipped into the big ugly bill. And we need to stand up the Department of Education again. This is affecting everyone.
Do you support policies to protect Social Security, Medicare, and other essential programs for seniors?
I do, and I'd like to see Medicare expanded to cover dental and vision and hearing. This is insane that we haven't done this already.
Do you support investment in broadband infrastructure and digital access to bridge the technology divide?
I do.
Last
And
question.
yes, I do.
Go ahead. Okay.
I was going to say, during the pandemic, I was the head of telemedicine for a health system where we worked really hard with the federal government to make sure we could expand broadband. So I have some intimate knowledge of this, and used to work with the Society of it's SCTE, the telecommunications trade group, to try and expand broadband.
Do you support federal initiatives for disaster resilience, climate adaptation, and infrastructure modernization?
I do.
That's it, all 10.
Fantastic.
All right, I have one last question before we move to our actual last question, which is, we do have a 6-person field. Should you not be the nominee in June, will you pledge to support whoever wins the primary?
Yes, wholeheartedly.
Okay. And Brian, over to you for our closing question. And then Tina, we'll open it up to the floor to see if any of the screening committee members have a follow-up.
So this is probably the hardest question. Campaigning is hard work. What about campaigning makes you happy?
Oh, you know what? I'm an extrovert, Brian. So this is kind of like candy to me because the job requires you to talk to as many people as you can. And I happen to love hearing people's stories. So I can't say fundraising is my favorite, but the aspect of listening to people's stories is probably my favorite.
Excellent. Thank you. All right. Does anyone have a follow-up question for Tina?
Yeah, Doctor, how long have you lived in the 7th Congressional District?
It's been close to a year. I will share that I grew up in Middlesex and I was living in Somerset immediately prior. However, Mr. Kersey, I have been practicing in the district for years. I practice in the RWJ system in Rahway, and I have a large family. My mom is one of 12. My oldest aunt is in Westfield, New Jersey, and my cousins have raised their children in Long Hill. And so I grew up coming into the district and spending time here with my family.
All right, Andy.
Okay, now one of the things I'm really excited about being a Democrat is the increased numbers of voters that are coming out to support Democrats. We saw that the mayor of New York, we saw that recently in the Texas primary, we saw that the primary that in CD7, Anna Lalia just won, and a lot of that I think is bringing out new voters, turning out Democrats. And I'm just wondering your thoughts, including a focus on affordability, helping protect the vulnerable. What's the strategy in your mind to help really expand our base and turn out even more people to vote Democratic?
Well, I think people need to see somebody who is just like them, who's thinking about how am I going to meal prep on the weekend so that the week goes all right, and is grappling, like I feel like I'm the anti Tom Kane Jr. because that man, he's never had to deal with regular human, like managing the household types of things. So, Andy, I'm excited to show people my true authentic self of how, I'm still grappling with basic life as I run as a candidate. I will also share, and this is a true story. So we just had the One NJ7 forum yesterday, and after that, a man came up to me who is South Asian, and he lives in Bridgewater, and he said, "Wow, this is incredible! I have 2,000 families I can bring right to my basement. Let's plan this." So I think we haven't tapped some communities. I'm just speaking to, starting with me being South Asian, of what we can do. There are, that's one example of a community that is leaning Democratic, but also excited to see someone that looks like them running that we haven't been able to touch yet. And it exists in Somerset, it exists in Morris. You know, it's time we pull on these communities, and that's something I can uniquely do. I will also say, as a person who practices in Rahway, this is another blue area we haven't, and that's in Union County. We haven't been able to pull voters from that area. So I think this is kind of exciting because that's also a hold for me as a person that, you know, treats community members in that area. And last, I'll say we've learned a lot from Mamdani and from Trump on how important it is, although it's not the only strategy, but how important it is to show yourself on social media. And I intend to continue to try and reach voters. And I'm on all the major platforms, including TikTok, including Facebook, including Instagram, because we don't know how people are consuming their information, but we do know that a lot of it's resting on social. And I'm not going to leave any stone unturned.
Excellent. All right. Anyone else? All right. Tina, you were in under the wire, perfect timing. So thank you so much for joining us today. We look forward to seeing you on Sunday, March 22nd at our nominating convention. And I hope you have a great rest of the evening.
Thank you. And I appreciate you all taking your time out. I know I'm battling, I was battling good weather, and I can't believe you all decided to stick it out with me.
This is true.
Here.
Right.
All right. Thank you.
Bye.
Take care. Bye-bye.